what's happening now is completely unprecedented in the history of medicine and across the world. We have the federal government, we have state agencies and hospitals telling doctors how to practice medicine. They're interfering with the sacred patient-physician relationship. They are telling doctors to be doctors. So I can tell you what happened to me. So I was using our protocol to treat critically ill patients in the ICU with a whole host of repurposed drugs. This is a memo. This is a memo sent to the entire healthcare system, but they targeted me personally. And what did this memo say? This said, I can use remdesivir, and then I will quote. There was an added section. Do not endorse section, which includes medications that may cause harm and efficacy is not supported in peer-reviewed, published RCTs. These medications will not be verified or dispensed for the prevention or treatment of COVID. This list includes ivermectin, bicalutamide, etoposide, fluvoxamine, dutasteride, and finasteride. And then just to stick it to me, they added ascorbic acid.
Otherwise known as...
The system was effectively preventing me treating my patients according to my best clinical judgment. And then how did this progress? I objected. So the first week I was in the ICU, I didn't know what to do. What was I to do? My hands were tied. As a clinician for the first time in my entire career, I could not be a doctor. I could not treat patients the way I had to be to treat patients. I had 7 COVID patients, including a 31-year-old woman. I was not allowed to treat these people. I had to stand by idly. I had to stand by idly watching these people die. I then tried to sue the system, and you know what they did? They did something called peer sham review. It is a disgusting and evil concept. They then accused me of 7 most outrageous crimes that I had committed, and that I was such a severe threat to the safety of patients, they immediately suspended my hospital privileges because I posed such an outright threat to these patients, ignoring the fact that under my care, the mortality was 50%, those of my colleagues. I then went on through the sham peer review. I went to a kangaroo court where they continued this, and the end result was I lost my hospital privilege and was reported to the National Practitioner Data Bank. So here I was standing up for patients' rights, and this hospital, this evil hospital, ended my medical career. So that's what they do. It's an outright outrage. It's evil to the core.
What? Why? Marik, why did they do that?
Just one second. Dr. Marik, did any of those cases that you were reviewed on, were they non-COVID cases? Were they pneumococcal pneumonia cases or staph sepsis where you used a broad range of your clinical skills?
These were all patients with COVID.
So it was specific to COVID, not any other condition where you would use your broad range of clinical skills. It was only on COVID
Absolutely.
that the review was applied, and it was applied in a way that was basically expressing and advising therapeutic nihilism, which means for the American public, therapeutic nihilism means the denial of treatment in patients in need.
This is the document which was sent to the entire healthcare system, which is the COVID-19 Comprehensive Treatment Guideline, which specifically was targeted at me, preventing me from prescribing safe, effective, off-label drugs. It's unprecedented in the history of medicine. The hospital is telling me how to practice medicine. They're denying me the right to use safe and effective drugs and lying because they claim
you can use safe, effective, off-label drugs for other conditions outside COVID.
Absolutely. If this was pneumococcal pneumonia, this wouldn't be an issue. This is specifically for COVID.
So let me ask the question, how has the hospital treatment of patients advanced, improved over the last 2 years?
So, sorry to continue. So it's a terrible thing for me to say. I'm an intensivist. I've worked in the ICU for 35 years. Hospitals have become dangerous places for sick people. Patients must do whatever they can to avoid the hospital. When they're imprisoned in a hospital, they're denied their rights. They are not allowed a patient advocate. Their family are denied access to the patient. They are prisoners in the system. They have no rights, and they get the treatment dictated by the hospital. They are dangerous places for sick people. And that's, for me, as a physician practicing hospital medicine for 40 years, saddens me to the core.
Yeah, there's two.